Welcome back now then. Jackie and Ian are still with us. Dr Ramir is here as well, alongside the chair of the charity Doctors in Distress, Professor Dame Clare Gerada, who works to provide mental wellbeing support for healthcare workers across the UK. Thank you so much for joining us this morning. Obviously, we would rather it was in different circumstances because your charity has been put under huge pressure, hasn't it, during the pandemic? Just explain a little bit about what the uptake in the services you offer has been like from doctors and healthcare workers from what you've seen.
Yeah, thank you very much and good morning. So Doctors in Distress provides support groups for all any healthcare professionals, so doctors, nurses, paramedics. And during the pandemic, we've been running groups, all remotely, of course. And what we're trying to do is to keep NHS staff well. Now, another service I run, which looks after mentally ill doctors, has seen a 100% increase in the number of people coming to our service with mental health problems. So what we've got is a problem, not just amongst doctors, but amongst all healthcare staff. And a recent survey has shown that of those surveyed, around about half said they wanted to leave. And of those, they talked about their mental health difficulties as the reason. So what Doctors in Distress is calling for is basically for every single healthcare staff to have funded a space where they can come together, seek help, wellbeing support, not mental health treatment, but support that is integral to their job plan. So they don't have to put their hand up and to say, I'm struggling, because many, especially those who are struggling, feel embarrassed, ashamed, frightened. But this has become so normalised that for an hour a month, you get funded time and space to seek the support and the help that I suspect that everybody would benefit from.
I mean, it seems logical, doesn't it? What is the problem with that happening? Is it just people not listening? Is it just that everything is already so stretched completely to the limit that there isn't room in the system for that?
Well, of course it's logical, and many people think it's extraordinary that those who are working at the sharp edge of caring for us and really doing the sort of jobs that we give them to do that are really difficult. And they think it's extraordinary that they wouldn't have paid reflective practice time. We all have to do continuing professional development. I have to learn how to do heavy lifting. I clearly have to learn how to do basic life support. And that all together takes about 13 hours a year for me to learn. So we're just asking for 1 hour per month, so you can do your maths, for every single healthcare staff to have a space and a time funded so that they can gain we call it mental health support, wellbeing support, reflective practice. You can call it what you like, but a protected time that is theirs, that they don't have to put their hand up and seek funding or go to HR and to say, look, I'm struggling, that it is there as part of their contract. Now, I don't know why such a simple idea hasn't become embedded within the NHS. Other professional groups have it, such as psychotherapists and counsellors. And I think we should have now every single healthcare staff has access to this sort of support, which will then be put on.
Some of the figures are devastating that have come out of your report. Every 3 weeks, a health worker commits suicide because pressure of work. We've got Dr. Mihir, and he talks about this a lot, don't you, as well? 1 in 10 say that, you know, they don't feel they can go on because of the pressure of work. I mean, it's a crisis point. If those we're relying on to save our lives, keep us well, are so unwell just for doing that job.
Yeah, and it is important that NHS workers remain well so we can continue to care for people. Last year, 27,000 healthcare workers left the NHS in just the third quarter of the year. That's a record number. That's 2% of the workforce. It's just incredible. Burnout stress, post-traumatic stress in particular, is really common in NHS workers. Just this week, I've spoken to a number of my patients who are NHS workers, and they come in and they cry. They don't want to go to work because of what they go through. They sit outside the hospital or the surgery that they may work at, and they just cry before going in. They often don't get breaks. Staff are off because of various other reasons as well. That puts added pressure on them. And it affects them outside of their home, their relationship with other people as well. And that is why it's having this impact on their mental health.
And what about you, Dr. Amir, you're a GP yourself. You have to look after your patients, and you have to look after all these other doctors and nurses that you're sort of managing.
Yeah, I mean, like I said, I'm a full-time GP, and I love my job. It is tough. It is busy. It's really hard at times, and you know, I think the mood of the nation has changed a little bit when it comes to the NHS as well. At the start of the pandemic, we were all applauding the NHS and supporting it. Now there's a slight mood as in, you know, why do we have to support the NHS? The NHS should be able to take care of itself, and that puts added pressure on us as well. It is tough. It's a tough place to work, but my colleagues are brilliant, and the support I have at home is brilliant.
What the professor's asking for, Jackie, seems sort of pretty straightforward, just in terms of the support it can offer. You are the head of a couple of NHS trusts, so you will understand the strains and the pressures in terms of delivering budgets. I mean, this sounds like this when we've got 1 in 10 posts in England in the NHS are vacant already. I think there's over 100,000 full-time positions that aren't filled, and we're getting this demand and the work pressures on doctors and nurses that we can't afford to lose, turning around and saying, we just can't face this anymore. It feels like the pressure on the finances to fund something like this that we feel like can make a difference needs to be found.
I'm really pleased that Claire is doing this work and putting this provision in place. If there is anything good that has come out of the pandemic, I think there has been a recognition in the NHS that staff well-being is really important, and a lot of schemes have been initiated over the period of the pandemic to support staff, and so they should have been, because it's been an enormously difficult time for people, up and down, thinking that we were coming through the pandemic, facing the new waves as they come at the service. And, you know, whilst you know, it would be expensive to do what Claire's suggesting, you're also absolutely right that one of our biggest issues is how we keep our workforce. And, of course, coming down the tracks, we have the potential impact of mandatory vaccination as well, which might mean that we lose staff from the NHS at a time when people are more sick, when we haven't trained enough people to come into the service. So anything that we can do to keep staff, to keep them healthy and to attract people into the NHS, I think is something that should have serious consideration. Obviously,
we've all been, you know, shocked and there's been reaction to the lack of pay increase for nurses and concern about that should be more. You know, there's funding for all areas of the healthcare that's tricky, and people feel that they aren't. People feel they're working very hard in very stressful situations for money that doesn't offer support on that. So the rest of their life is very stressful. How much is it a good idea to give people better pay, or would some kind of funded support within the system be better? Do you know what I mean? Because we know that money's limited, but we've got to find some way to ease the pressure.
Well, let's be clear. An hour a month for people would also cost money. Now,
well, exactly, that's what I mean.
Yeah.
Do we put money into something like that so that the working environment is more supportive, or do we give people better pay so that the rest of their life is easier to manage?
Well, without looking profligate about the public's money, I think you probably have to do both.
Yeah.
And it would be a good investment, because the most difficult thing, as I say, for the NHS is where you've got shortages of staff, because, frankly, to fill those through bank and agency workers also costs a lot of money. So investing in getting people into the service and keeping them in the service is well worthwhile doing, alongside other support that you need to put in place.
And at the same time, Ian, the national insurance hike, which we know is going to go to help the NHS, albeit ultimately for social care.
And the backlog for the NHS.
Yeah.
Well, though, yeah.
At present, there's questions over whether they're going to delay that because the cost of living is being squeezed everywhere.
I think one of the reasons that mental health has never been given the priority that it probably should be is because most people do not suffer from mental health problems. So you've almost been able to rely on the fact that the electorate are never going to say that's the one thing that we ought to do. I mean, look in this studio, there's, what, a dozen people here. The chances are that one of us in the studio does suffer from quite severe depression at some time, but probably doesn't talk about it, probably doesn't know where to go to get that support, and that's reflected in the population. And it will certainly be reflected in the NHS, given the pressures that there have been over the last couple of years. So it is a real challenge to know what to do about that. I don't know how much it would cost to implement an hour a month to enable people to have that kind of access, but it wouldn't be a cheap thing to do. And it comes back to money in the end, doesn't it? Always, because everything, and the government is there to decide what the priorities are, and we then decide, well, if they've got the priorities right, we re-elect them. If they haven't, we don't. But there are only two ways of funding things: taxation or borrowing. And if they delay the tax hike, that means the borrowing will go up. There's no, as we always say, there's no magic money tree. In the end, the money has to come from somewhere.
The problem is when you see that the Foreign Secretary has used a jet, which could have been done something different, that cost, you know, £500,000. It jars to an extraordinary degree, particularly if you've just done a 14-hour shift on a ward in great stress, and that's the problem, isn't it? I'd say no easy solutions. But
Sadly, we're out of time. It's great to have your thoughts, Ian and Jackie. Professor, thank you for joining us as well, and good luck with the campaign, because clearly Doctors in Distress is hugely important and needed, as Kate says right now, and Amir, good to have you with us as well.